welcome to one of the most exciting research presentations at SOAR today. I'm just kidding. Thank you everyone for joining me in Breakout 1. My name is Tejal Rangdol, and thank you, Thomas, for such a nice intro. I'm here to welcome you all into very fascinating research I did to develop my own company and got it patented in late 2018 with one mission, which I'll share at the end. So keep your curious modes on as I begin to share more about how NectAid can help reduce ER wait time confusion for non-emergent emergencies with definitely AI and data-driven real-time tracking. Oops. Okay. Today, one of the biggest problems in ER is not knowing where to go, how long you'll have to wait, or if you'll even be seen by the right provider. And this isn't hypothetical. You can fact check me. It's the reality for millions of patients in many hospitals every year around US. In fact, there are nearly 155 million ER visits annually with patients waiting an average of 7 hours, many walkouts without care, untreated, frustrated, and very anxious. Hospitals feel the pain too, like they lose thousands of dollars for each patient who leaves without being seen, and they struggle to manage the beds and staff effectively because patient arrivals are really unpredictable. Well, what's the result of all this? There is chaos, there's wasted time, and a loss of revenue for both the patients and the hospitals. Now, what's the solution for all this problem, Tejal? It's NectAid. So NectAid user under like EAS, Emergent Access Services, is a patent-awarded ER app that lets non-urgent patients wait safely wherever they choose and receive notification when it's almost their turn to see a physician. Our app uses real-time technology to connect patients to the right hospital, the right provider, and the right care, bringing all the order to this chaos. And with just a few steps, patients can see hospitals near them in real time with accurate wait times. They can check into the ER virtually, joining the queue right before they even arrive, waiting at their very comfy homes instead. And providers instantly see who's coming in and what they need so that they can prioritize smarter care and use resources where they really matter the most. We have integrated with platforms like Epic, the AHR system, and are currently doing seed funding rounds and piloting initiatives at both coasts, like East and West, and moving in from an LLC to deliver C Corp sooner. So NectAid isn't just any other app, it's the ways of emergency care, turning chaos into clarity, giving patients the transparency that they want, and giving the hospitals the predictability they need, all with one word: data. And in other words, what I like to call it is one platform, one source of truth, one stop shop for emergency access. Now, this is a quick glimpse into the app, but I'm here to talk about the research and not a business pitch, the real grind that went behind building this NectAid. And that went behind like developing this from a problem into a solution. So I come from a biomedical science background and with a very curious mindset. My first question to myself when I waited for 11 hours in emergency care was, if patients are given real-time ER wait data, will they choose lower wait facilities, feel more confident, and reduce the strain on overcrowded ERs? But in order to like frame it more properly into a research question, just wording really matters when it comes to research. So, can real ERV data help patients make better choices and reduce that overcrowding? And just like any other research, when you have a question, you formulate a hypothesis. And in my case, my hypothesis could only come into the picture when I had a prototype to even showcase what I'm talking about to hospital executives. Like I said, I'm not a computer science background. I utilized software AI, generative AI myself in order to build NectAid, and it worked. There was an intense time with data we pull. We are a non-HIPAA compliant because aggregate wait times are not PHI because we fully de-identified the data. So some hospital system, even in date, do share like their publish their wait time on public sites or even via open APIs. And these are usually contained estimated wait time only with no patient level information. So nothing to do with HIPAA compliancy. User testing and data collection was even performed. There was accuracy, confidence, reduction, and usability that were tested, which I'm going to be talking later. But the big wins here are patients, more than 200 patients submitted letters of intent supporting NectAid. Companies like Epic expressed readiness for seamless integration through their sandbox program for testing and highlighted the value in leveraging their built-in base, user base, and experience. And with that being said, there are a couple methodologies we use. Like I said, we use software, a no-code platform, like I mentioned. But with that comes in FHIR, Fast Healthcare Interportability Resources, and Health Level 7 in international standards, HL7, which were maintained for the structured data exchange. And data is usually like surfaced through hospital-owned and vendor-managed APIs. And as we talk about participants and processes in order to access how easy and intuitive our product is to use, we use something called as SAS, which is System Usability Scale. And in other words, it measures other measures that were used were to evaluate how effectively and confidently users that are patients can make the care decision in critical time, measuring their efficiency, like accurate ER choices, their confidence, self-assurance in their choice, and even like perceived uncertainty, like stress reduction during the decision process that they might have in the very critical moment of time. And a brief system overview over here is that NectAid really aggregates that kind of hospital wait time data from public dashboards through APIs and simulated feeds from added geolocation, and obviously calculates a load index, what we call, in order to rank the nearest ERs by current demand. So it's definitely built on no code. I know people get fascinated by this, but yes, Gen AI is doing great. Software is doing great. We had to take a subscription, but we used no code stack for really fast integration, and we did more than like 120 integrations to even come to where we are today. So it includes like confidence brands for like data freshness, clear safety messaging, and also accessibility features to support informed non-emergent care decisions. This is my favorite slide of all, and I'm going to tell you why. So let's imagine the ER as a highway at rush hour. Most cars, or in our case, patients, aren't actually in crisis mode. And that's the case why there is a lot more wait times. Even a small lane shift of non-urgent traffic can ease the jam. So that's what redistribution does. By guiding the patients to less crowded ERs, we smooth the workflow, reduce that pressure on overloaded facilities, and give everyone a better experience, the hospitals and the patients. But confidence is the key. So when patient knows what to expect, they feel safer and more in control, even in their safe space, their home. That's why NectAid doesn't just show numbers, it shows how fresh that data is, flags the uncertainty, and sets more realistic expectations, even on the hospital's ends, because posted times aren't always lived reality. We all know emergencies come in and go, and that kind of has that variability in how the data is or how the wait time is. And equity matters too. So we can't build something only that tech savvy benefit from. So we push like a lot of like multilingual support, SMS based access, and a very low bandwidth design. Even community healthcare workers can outreach this platform to make sure it isn't a privileged tool, but an accessible tool to all. And from the hospital side of things, the magic is really non linear. Like a modest demand shift doesn't just move patient, it prevents those surge tipping points where wait times spike dramatically. And if multiple hospitals in a region adopt this, we can smooth the system like a well-synced orchestra and not a series of like competing soloists. So looking ahead, machine readable, fast track, and imaging availability can really unlock even smarter routing. That's still an integration we are going to develop in our app. And that's not just redistribution, that's redefining that patient flow for real world impact. NectAid improved decision making and user experiences, like selection efficiency rose by 40%, the confidence in patients by 65%. This is all through the data that we gathered, and perceived uncertainty dropped really by 30 minutes. So that's pretty huge in emergency care. And comprehension was really, really high. We skyrocketed there with a 95% mark, recognized non-emergency guidances. And usability was excellent, like our SUS I talked about earlier is 82.5, with users praising very clear rankings and last updated queues. What next steps we do see and kind of limitation is that we do have a very small sample size, and we are still like doing our best to outreach for, piloting our app into Kaiser or nearby hospitals. And I do have a founder who is helping me do this because I'm a part-time student. I'm also a part-time, full-time worker and doing this all together. But what next steps really look like in our case, like the future work, is that secure real-time data sharing with EDs and adding that predictive models with fairness checks, expanded to urgent care and symptom guided routing, and run like a very stepped wedge trial to measure that kind of impact flow, what we call LOS, LWBS, and the patient experience, most important for all. Also, AI is huge in today's world. We all know that AI is like the coriander I talk about in a Mexican food. It needs to be there everywhere. So we are in progress of the AI bot called Elsa for audible services for blind societies. And we are kind of trying to implement this starting from Atlanta, Georgia, because I have some connections there for from blind society workers who are ready to, focus this and practice this in their industry. Finally, NectAid does show a very early promise that real-time wait time transparency can guide that non-emergency patients more effectively in chaotic situations. And with the right focus on accuracy, ethics, and equity, it can really complement systems operation and empower a very smarter care choices with data and AI. Now, for the most awaited part, and thanks for the curious minds. My mission is I dream of a healthcare experience so intuitive, it connects every patient to the right provider faster than it took you to read this or listen this. So that's a little about me already. Thomas has shared a lot about my background, so no need to touch base on that. But I recently attended the MedTech conference in San Diego. I just came back last night, and it was a huge win to see all the innovations out there. But one thing that was missing there was NectAid. And I have a vision to, scale this up to reach to most society and help in everything like underprivileged societies as well as the overprivileged, because I know healthcare should be equitable for all. That's my vision. Here are some references like I used to gather my data from in my early stages, but only some of them would be like very relatable because most of them are gathered by NectAid itself. But these are also the relevant references. Thank you so much, and it was exciting to have my presentation here at SOAR. Ready for questions?
Yes, thank you so much. So the first question is this program for hospital use or is it patient use? And if it is patient use, are they able to check in through the app as well?
Yes, they can check in through the app and you can wait and join your queue online. Now, there is a plus point to this that I want to mention is we are in talks with Uber integration. So if you are joining in online and let's say you're an international student like me, or let's say that you have cut a finger and you cannot drive yourself. So the best thing you can do is 30 minutes before your time to see the provider, the Uber comes in and drives you to the hospital and lets you check in. So you can join and wait from your homes, get text messages all times from our app itself. And yeah, it's for both like hospitals and patients. Like hospitals themselves can see, okay, what are the symptoms of the patients who are coming in? So they can be prepared beforehand on which provider to have next in the emergency care. And that's kind of a visibility on both ends.
All right, thank you. There's another question. Is this app able to filter based on patient insurance plan? What ER service agencies are included in emergency departments? Urgent care, pop-up clinic, and critical care can solve many things. How they will be directed to particular group.
Yeah, so what we can do is like add on a filter, like according to what insurance plans you have, you'll be able to see the nearest hospitals that accept that insurance with a low deductible. But our main purpose right now is to, just showcase that queue to the nearest hospitals and not really insurance focused because many options that we have are Epic integrated and Epic uses United Healthcare mostly, my chart and everything. So We don't have an insurance filter down yet, but that's a good suggestion that I think our next integration can add on to and, can filter it down to hospitals that can accept my insurance and move forward with that. Thank you.
Okay. Yeah. So, how do you measure the reduction of patient insecurity?
Insecurity.
Patient insecurity.
So I still need to get what the question is about because a patient can feel insecure for multiple reasons. And for a direct answer to this, I might not have one because patient insecurity also comes from what I have seen through the data that I have gathered from my patient data that we receive for NectAid is that they are insecure about the wait times. They're insecure about the people who walk into the emergency cares. While they're waiting 8 hours, there can be, um, well, I don't have a better word to say this, but there can be some homelessness around them that hops into the emergency care. They feel insecure around that regions. So what our app is basically doing is making that insecurities less and one way to measure that was through that SUS that I was talking SUS unit that I talked about earlier. And also, when we are trying to gather these letters of intent, people are filling in our forms and they mention, okay, after using NectAid and before using NectAid, what are your feelings about emergency care? And they were like, okay, after using NectAid, I don't see that point of being stressed out about, being around a population who might as well have some viral infection. So while I'm waiting on my turn to see the provider with some kind of infection, I don't want to um, get on some more viral, infections in the same time. So it's like the patient insecurity is definitely decreased, and we have measured this through our data, like what is the satisfaction level, the SUS number, and what's the chances for the patients to still stick with the same hospital and reduce the walkouts. So that's a huge win. Like I said, 92% uh, win in reducing that walkouts.
Okay, so we have another question. Um, I think it is earlier you stated that hospitals can lose 1.7 million for patients who leave the get. How would you address possible concern from hospitals that they would lose potential clients to other facilities because their wait times appear higher on the app? Additionally, what ways would NectAid profit from this app?
Yeah, so I would say that the best part about this is people in hospital generally, I'm not saying because I come from a faith-based organization, Adventist Healthcare. We were a faith-based organization based in NorCal. But even other hospitals, their first priority, their mission, if you read onto their statements, for every single hospital, whether it is university related, non-university related, their mission is patient first. They have that kind of attitude of patient first. And they care about is not the dollar amount, but what they care about is that the patient needs to get treated, whether it is at our place or the others. And that
Both are good.
yeah, and that's kind of the scenario like even in MedTech conference that I got to see. There
Um,
Can you hear me? Okay.
Yes, we can.
So there are like a lot of competitors. Let's say I used to work in Edwards Life Sciences. We have BD, Johnson and Johnson, but they all the competitors are looking at one aspect, how we can together collaborate in order to help the patient care and to better the healthcare in general. With that mindset is what we are signing the contracts, even with private hospitals and with the public ones, they are sharing their data in real time publicly in today's world. If you go outside and see Piedmont Care, like they're still sharing the data online on their websites with the current wait times. So they're not hesitant to lose their patient. All they want is everyone should be treated equally and efficiently, seamlessly in this today's world. So I'm really proud and happy to see that kind of hospitals coming in and jumping in with their contracts.
So another question, coming from healthcare background, I can see you're solving for a real problem. This
Yeah.
will also help alleviate caregiver burnout, which
Yes.
is predominant in ERs, I think. Thanks for a great presentation.
Thank you.
Okay. And now the next question is, of course, I like the idea. Is the app already released or still in development?
So the app has been still in development, and we can only release once we get our app with the final integration patent. Our idea and everything related to it is patent, but the latest integration is not, and it's going to come under Emergent Access Services, EAS. So be tuned in. Once it comes in, I'll definitely love to share with everyone in Westcliff as well in my classes and through the university reach out. Yeah.
And thank you. Another question. How do patients using the app deal with the issue of triage?
Triage care. So that's not like currently. So basically, like triage works differently as compared to NectAid, or you can call ES, which is what it's gonna come out. Triage is like when they have different levels of, I would say, emergencies, and that's when they kind of manage, okay, which provider is gonna come in and treat what kind of patient. But in our app, we are just dealing with wait times. Triage is very much HIPAA compliant. It takes in patient data, it takes in the vitals, it takes in the age and everything. So I would say it's not a competitor. It's a complete different idea as compared to triage monitoring.